A Tulsa man, the first in the state, confirmed to be infected with coronavirus. He traveled to Italy in February, and tonight he and his family are in quarantine in their home. 2 Works View's Katie Kelleher joining us now to tell us just how the city and the state are responding.
Karen, officials say they were prepared for this because it wasn't a matter of if the virus would come here, but when. And they say despite this confirmed case, the risk for others is low.
I'm calling on my fellow Oklahomans to do their part to prevent this spread.
State, city, and health officials coming together Friday afternoon announcing COVID-19, or the coronavirus, is in Oklahoma. The Tulsa man traveled to Italy and landed at Tulsa International Airport February 23rd, then started seeing symptoms February 29th. They said he called his healthcare provider and went into quarantine. If we get more cases, the state health commissioner says Oklahoma can now test for the virus and have results in 6 to 8 hours.
We have the capacity to do 100 tests per day on one shift, and should the need arise, we can do 3 shifts, so we can do around 300 per day.
Officials said they're compiling a list of the places the man visited before his quarantine, but the mayor insists the risk to others in the city is low.
There's no evidence of community spread at this time. And the most important thing for all of us as Tulsans to do is to focus on what we can control, and that is preventing infection.
Health officials said the man is feeling better, but for now, he and his family will stay in quarantine.
That person remains in isolation until they have a couple of tests that are negative for novel coronavirus to assure they're not infectious. The other part of this is identifying any exposed contacts and then monitoring them and limiting their movement as well.
Health officials also warned to people with spring break coming up, be careful if you're traveling internationally. And Karen, one of the best things you can do is wash your hands often.
All right. Thank you so much, Katie.